I'll be presenting today's Radiopedia.org case in radiology, complications of otitis media. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 35-year-old male presenting with a tonic-clonic seizure. The patient is noted to have suppuration from the right ear. The patient suffers from recurrent otitis media in the right ear. On CT, we see thin parietal subdural collections bilaterally, with the right greater than the left. These likely represent bilateral subdural empyemas. There's also an air fluid level within the left maxillary sinus and bilateral mucosal thickening of the maxillary sinuses. The patient is noted to have underdeveloped mastoid air cells bilaterally and opacification of the middle ear on the right side with adjacent right-sided temporal pneumocephalus. We also see that there's a non-occlusive thrombosis in the posterior part of the superior sagittal sinus. The patient underwent brain MRI, verifying diffuse cerebral edema, bilateral subdural empyema, superior sagittal sinus thrombosis, and left frontal subarachnoid hemorrhage. The patient had been suffering from recurrent right-sided otitis media, only this time it resulted in meningitis, plus the aforementioned complications. The dural venous sinus thrombosis was probably responsible for the subarachnoid hemorrhage. Blood cultures grew Streptococcus pyogenes. Despite rigorous treatment, the patient passed away.